My name is Brock Nelson. I'm the President and CEO of Regents Hospital. I came in 2003. When I arrived, we had a lot of facility issues, and we had a lot of issues about where we put services and programs for our patients. We actually engaged Kraus-Anderson probably a year prior to that point where we had a package or a plan ready to go. And so Kraus-Anderson helped us look at how we could minimize disruption. So their involvement from the starting point was tremendously valuable. And throughout that entire process, Kraus-Anderson was a great partner.
My name is Heidi Conrad. I serve as the Chief Financial Officer here at Regents Hospital, and as part of my responsibilities, I oversee facility planning and construction. Obviously, it was just an enormous project, very multifaceted, and was key to us to make sure that the existing facility and the new facility were seamless from the inside.
Probably more challenging, though, was not the new construction, but rather how does this move impact our current operations and how does it all tie together? We opened up this new ER without disrupting at all in any way our existing ER services. We opened up our new ORs without disrupting in any way our operating room suites.
What we appreciate most about Kraus-Anderson is they're really more than just a contractor. They're truly our partner in all ways, whether it's on our expansion project or our normal facility improvements we're making on a day-to-day annual basis. Big or small, they're really there to help us make sure we're doing our projects as efficiently and as effectively as possible, and really saw that in so many ways on the expansion project. We were millions of dollars under budget, not cut quality of the project, but look at ways we could stage efficiently, so to cut unnecessary cost out of the project so we can put as much of it into the actual facility itself. That for us on the expansion project meant we could complete an additional floor. We were able to do some other finishings we weren't expecting to be able to do, and even do some other projects in our existing facility that were never contemplated as part of the original expansion. But we were able to do it because they brought so much value to the project. Because we have such a great partnership, we keep Kraus-Anderson here on site all the time. We've got somebody here every day helping us problem solve so projects go smoother. We typically come under budget on almost every project we do because we've got that day-to-day on-site management.
As part of that long-range plan, we had planned when that was completed to do mental health services, and initially we were planning to renovate some existing circles in our existing facility. And with Kraus-Anderson here, we started looking at, is that the best use of the space, and what would that cost to renovate them? And lo and behold, we came up with a novel idea, which is today beneficial in spades. We said, let's start new.
I'm Rachel Oakey. I'm a project manager with Kraus-Anderson, and we are on the Regents mental health job site. It's a tight site, and through the middle of the site there were a lot of utilities running through, including sewer, chilled water. We had a fiber optic line. All the utilities that fed the campus went right through the center of this site. So we had to remove those, reconnect them temporarily to another location, build the basement, and then reconnect those utilities right back through the basement without interrupting the hospital service. We used auger cast piles here for the foundation, which is auger that drills into the ground rather than pounding pile into the ground, which causes a lot of vibration. So that was one way that we avoided some of the noise and vibration factors here. We did actually install a vibration monitor into the building directly adjacent so that we could monitor the level of vibrations that we were causing, so that if there was a problem, we knew it would set off an alarm, and then we would know that we need to stop that work before we got to the point where we would affect the MRI that's directly adjacent to the site. So there's a number of features that are included in the construction of a mental health or behavioral health facility that we incorporated into the design and construction of this building. That includes things like anti-ligature doors, faucets, shower hoses are removable. We have continuous piano hinges. The door hardware is special hardware that is anti-ligature. We also have reinforced drywall with security mesh behind it. There are also areas in the building that are higher security that include special locking functions.
We're going to end up opening a brand new mental health facility that not only is structurally well done, cost efficient, more importantly, it represents all the things we want in a building in terms of environment, our approach to care. It's the labor of love for people who've been involved in that project, and a key partner in that was Kraus-Anderson.